You wake up, nothing hurts, nothing feels wrong, and yet something in your body has already changed while you were sleeping. Not just last night, for years. Here's the uncomfortable truth almost nobody explains clearly. You can lose a real, measurable amount of muscle strength every single year after 60, and still feel completely normal at first. No pain, no warning bell. Just a slow, silent shift that only becomes obvious once it starts stealing things from you. The jar you couldn't open. The stairs that suddenly feel steeper. The chair you used to stand up from without thinking, and now you push off with both hands. This channel exists to help you catch these changes early, using real documented information, not fear, not guesswork. And before we go further, one honest disclaimer. Because your health deserves honesty. This content is for educational purposes only and is not medical advice. Please consult your doctor before making changes to your diet or routine, especially if you take medication or have a health condition. Everything we share here is meant to help you ask better questions, not replace the answers only a doctor can give you. Today we're talking about sarcopenia. It has a clinical name, a real definition, and real warning signs that most people over 60 are already showing, without knowing what to call it. By the end of this video, you'll know exactly what to look for in your own body and in the people you love. That flat tire moment tends to arrive around 60. This is the part almost nobody tells you clearly. The rate of loss does not stay the same throughout your life. It accelerates. Studies on aging and muscle physiology show that many adults lose around 1 to 2% of muscle mass per year, starting in their 50s, but strength losses can climb to 3% or more per year after age 60. That's not a small detail. That's the difference between a slow decline you can barely notice and a sharp drop that starts affecting how you walk, how you carry groceries, how confidently you move through your own home. But there's something even more specific, and this is the part almost no one talks about outside of research papers. Muscle strength and muscle power are not the same thing. Strength is how much force your muscles can produce. Power is how quickly you can produce that force. The ability to catch yourself when you trip, to push off a chair fast enough to keep your balance. And power declines even faster than strength. Research on aging muscle function shows that muscle power can drop by 3 to 4% per year after age 60, compared to only 1 to 2% for strength alone. This matters more than most people realize because power loss hits a very specific type of muscle fiber first, fast twitch fibers, the ones responsible for quick, explosive movement. So why does this happen? It's not just getting old in some vague, unavoidable sense. There are real biological reasons behind it, and understanding them is the first step to doing something about it. But here's a detail that changes everything, something researchers call anabolic resistance, and it's one of the most important things you'll hear in this video. When you eat protein, your body uses it to trigger something called muscle protein synthesis, basically the process of building and repairing muscle tissue. In younger adults, a relatively small amount of protein at a meal is enough to trigger that process efficiently. But research published in a nutrition journal found that older adults need roughly twice as much protein per meal as younger adults to trigger the same muscle-building response. Think about what that means in real life. If you're eating the same way you did in your 30s or 40s, the same portions, the same protein habits, your body may no longer be responding to that food the same way. You could be eating enough by younger adult standards and still not be giving your muscles what they need to repair and rebuild themselves. This single fact explains why so many people in their 60s and 70s feel like they're eating fine, and still losing strength. It's not about willpower. It's about a shifted biological threshold that almost nobody explains to you. Now, before we get to the part of this video where we walk through the specific warning signs, one quick favor. If this is the kind of information that actually feels useful to you, take a second and subscribe to this channel. We put out content like this regularly, built on real research, not fear tactics. And if you're the kind of person who likes to remember what you learn, drop a comment below with the one fact from this video so far that surprised you the most. The first sign is a change in how you get up from a chair. Early on, this looks small. Maybe you start pushing off the armrests with your hands instead of standing straight up using just your legs. The second sign is grip strength. This one might sound strange, but it's actually one of the most clinically important markers researchers use. In everyday life, this shows up as struggling to open a jar that used to be effortless. The third sign is your walking speed. Researchers describe this as one of the earliest and most noticeable indicators of muscle loss aging. Maybe you've noticed you're falling a little behind when walking with friends or family. The fourth sign is more serious, and it's one you should never brush off: frequent falls or near falls. Health researchers point out that type 2 fast-twitch muscle fibers weaken first, and these are the fibers your body relies on to catch itself. The fifth sign is unintentional weight loss, especially when your diet hasn't really changed. Losing weight while your muscle mass is quietly declining can signal more advanced muscle loss. This is weight disappearing on its own, without you trying. The sixth sign is something you might notice when you get dressed. Your clothes fitting differently, sleeves feeling looser around your arms, pant legs feeling roomier, even if your overall weight hasn't changed. It's about the composition shifting underneath your skin. And the seventh sign is postural. Losing strength in your core and back muscles can lead to a more hunched-over posture over time. This creates a difficult cycle, as poor posture leads to more muscle strain and a higher risk of falling. Here's what makes these signs so dangerous. None of them show up all at once. They creep in disguised as normal aging, until one day several have stacked up together and you're dealing with a real functional limitation. Sarcopenia is not rare. According to figures referenced by the Cleveland Clinic, sarcopenia affects somewhere between 5 and 13% of people over the age of 60. And that number rises dramatically as people get older, climbing to somewhere between 11 and 50% among people over the age of 80. This is not a fringe issue. This is a mainstream, widespread part of aging that most people simply don't have language for, because nobody sat them down and explained what it actually is, or what to watch for. And the stakes are not abstract. Muscle weakness from sarcopenia is directly connected to a higher risk of falls and fractures, and both of those are strongly associated with hospitalizations, loss of independence, and in more severe cases, a real decline in quality of life. This is why catching these signs early matters so much. It's about whether you're still able to carry your own groceries in 10 years, whether you can get up off the floor on your own if you slip, whether you can keep living in your own home, on your own terms. But here is the part of this video that actually matters the most, the part where this stops being frightening and starts being useful. Sarcopenia is not a fixed sentence. With the right exercise and nutrition approach, you can slow it down, and in many cases, meaningfully improve strength and muscle function. The European Society for Clinical Nutrition and Metabolism recommends that healthy older people consume at least 1 to 1.2 grams of protein per kilogram of body weight every single day. Some nutrition researchers reviewing the evidence have argued for an even more protective range, around 1.2 to 1.5 grams per kilogram, suggesting that the standard minimum guidelines were built to prevent deficiency in young adults, not to protect aging muscle. To put that in perspective, 1 kilogram is about 2.2 pounds, so this isn't about eating enormous amounts of meat at every meal. It's about being intentional, making sure protein shows up consistently across your day. There's also a specific amino acid worth knowing about, leucine. Research suggests that a daily leucine intake of somewhere between 5 and 8 grams may provide an optimal balance for stimulating muscle protein synthesis in older adults. Leucine is found in high-quality protein sources like eggs, dairy, poultry, fish, and meat. This is not about buying expensive supplements first. It's about understanding that protein quality matters just as much as protein quantity. And nutrition research has uncovered something else important. Protein alone isn't always enough. Gains in strength were more closely tied to having adequate levels of vitamin D and vitamin B12 than to protein intake alone. Now, the second half of the equation, and honestly, the half that makes the biggest difference, movement. Specifically, resistance training, exercise that challenges your muscles against some form of resistance. Here's why this matters so much. Regular aerobic and resistance exercise programs have been shown to counteract most aspects of sarcopenia, according to research summarized by nutrition and aging experts. And remember those fast-twitch fibers we talked about earlier, the ones responsible for quick, powerful movement? Resistance training is one of the few interventions specifically shown to help preserve and rebuild that exact type of muscle fiber. This doesn't mean you need to start lifting heavy weights at a gym tomorrow. It means consistent, appropriately challenging resistance movement guided by a doctor or qualified professional. The research is clear that protein and resistance exercise work best together, almost like two ends of the same rope. Protein gives your muscles the raw material to rebuild. Resistance training gives your body the signal that says, "We need this muscle, don't let it go." There's one more risk factor we need to talk about: inactivity. Not laziness, inactivity, the kind that happens involuntarily during a hospital stay or during recovery from surgery. Research shows that episodes of inactivity as short as 5 days can be associated with rapid muscle and strength loss. A single hospitalization can quietly accelerate the very process we've been describing. Researchers describe this as a kind of chronic muscle anabolic resistance that builds up through repeated short episodes of disuse over the years, each one chipping away a little more. This is exactly why staying as physically active as possible matters so much. If you're facing a recovery period, ask about safe ways to keep moving, because muscle lost during inactivity does not always come back easily. Now, here's something practical. Researchers use 5 questions as an initial screening step. Difficulty lifting heavy objects, needing help walking across a room, difficulty rising from a chair, climbing stairs, and how many times you've fallen in the past year. Consider a woman in her early 70s who noticed she'd started holding the stair railing with both hands. Then came a fall in her garden, a stumble over a hose, but it left her shaken enough to finally mention it to her doctor. With her doctor's guidance, she started a supervised strength program and became more deliberate about protein at breakfast and lunch. This is the exact pattern researchers describe: a noticed symptom, a conversation with a doctor, and a structured plan. There's one more twist. You do not have to look thin or frail to have significant muscle loss. This is called sarcopenic obesity, and it happens when muscle mass declines while fat mass increases, creating a deceptive stability on the scale. The number doesn't move much, so nothing seems wrong. But underneath the surface, the body's composition has shifted dramatically. Close to 14% of older adults are affected, and it hides because standard weight-based checks aren't built to catch it. And there's a cruel cycle hidden inside sarcopenic obesity. Muscle loss leads to less physical activity. Less activity accelerates further muscle loss. Meanwhile, increased fat tissue promotes inflammation throughout the body. That inflammation actively interferes with the muscle-building process itself, making it progressively harder to rebuild what's been lost. Research has found meaningful associations between elevated inflammatory markers and sarcopenia. This is why generic "just eat less and move more" advice can backfire. Cutting calories aggressively without enough protein and resistance training can accelerate muscle loss while barely touching fat mass, the exact opposite of what you need. This is precisely why nutrition or activity changes need a doctor's involvement if you're over 60. What worked in your 30s can work against your muscle health now. Only a professional looking at your full picture can guide that safely. Guidelines suggest that combining resistance training with aerobic activity, things like walking, swimming, or cycling, tends to produce the best overall results. Aerobic activity improves oxygen delivery, while resistance training specifically targets strength and muscle preservation. How you spread your protein across the day may matter almost as much as how much you eat in total. Concentrating most of your intake into a single meal may be less effective than spreading a meaningful amount across breakfast, lunch, and dinner. There's also a connection between sarcopenia and sleep. A meaningful portion of muscle repair work happens overnight while you sleep. Poor sleep quality and chronic inflammation tend to go hand in hand, interfering directly with muscle protein synthesis. Chronic conditions like type 2 diabetes or kidney disease are associated with faster rates of muscle loss. Your doctor needs to be part of any plan you build, because protein targets and exercise intensity can shift significantly depending on what else your body is managing. Let's zoom out for a moment and talk about why all of this actually matters beyond the numbers and the research citations. Muscle isn't just about looking strong or being able to lift something heavy. Muscle is what lets you get down on the floor to pick up your grandchild's toy and get back up again without help. It's what lets you carry your own suitcase through an airport instead of asking someone to do it for you. It's what keeps you steady enough to walk on uneven ground, a hiking trail, a cobblestone street, without the fear of falling shadowing every step. Losing muscle isn't just a physical change. It quietly shrinks the size of the life you feel confident living. And building it back or protecting what you still have does the opposite. It expands what feels possible again. This is exactly why catching these 7 warning signs early is so much more than a checklist. It's the difference between managing a small early shift in your body on your own terms versus reacting to a crisis after it's already taken something from you. A fall, a fracture, a hospital stay that then triggers the very inactivity spiral we talked about earlier. Early action isn't dramatic. It's quiet, consistent, and remarkably effective, and that's exactly why it doesn't get enough attention. Before we close, let's clear up 2 myths. The first, I'm too old to start strength training. This is not supported by research. Your muscles retain the ability to respond and adapt to resistance training throughout your life. Starting later doesn't mean starting too late. The second myth, more protein is automatically bad for my kidneys. This is true for existing kidney disease, but for healthy older adults, evidence doesn't show the harm many assume. A personal conversation with your doctor matters most, as they know your specific health picture. Let's do one final recap. Watch for these 7 signs: needing to push off to stand, a weaker grip, slower walking pace, frequent falls, unintentional weight loss, clothes fitting looser, and a hunched posture. 2 or more together is a pattern worth bringing to your doctor. Remember the 2 levers you control. Protein spread consistently across your meals. and resistance-based movement. These are the most effective tools for slowing and improving age-related muscle loss. So let's bring this back to you. If any of those 7 signs sounded familiar, that is not a life sentence, it's information. And information you act on early is worth far more than information you discover after a fall lands you in a hospital bed. If you ignore these signs, the pattern doesn't stay still. It keeps moving in the same direction. But the moment you decide to pay attention, that's the moment the pattern can start bending in a different direction. One more time, this content is for educational purposes only and is not medical advice. Use what you learned here as a reason to start a conversation with your doctor, not as a replacement for it. If this video gave you something real, subscribe to this channel. Drop a comment telling us which sign hit closest to home. And if there's someone in your life this could help, send them this video today. Thank you for watching. We'll see you in the next one.